means.
Good morning. Name that tune since we were talking about soap operas.
Good morning, everybody. They got a private joke going on here. Welcome to Human Services. We're going to start with the minutes of February 24th, 2021. Do we have a motion to approve those, please?
I'll make that motion.
Thanks, Don.
Paul.
Paul. Okay, thanks, Paul. And Don seconds. All in favor?
Aye.
Aye. Thank you. Okay, so we're going to go into Youth Bureau. I think I saw Mike Ray. Hi, Mike. Good morning.
Yes, good morning, everyone. Thank you. I'd like to begin by asking permission for a budget resolution to amend the budget for the cost of program specialists. There's a appropriation code we amended 7310-121 by 32,900, an increase A 7310.8 by 13,604, and then the overall increase would be increase revenue of $46,504 to 7310-281.01. This is reflect budget amendments as a result of working with DSS to increase revenue through STSJP. So
moved.
Okay, Brian makes the motion. Do we have a second? Don and Paul, is there any discussion on this? Okay, all in favor?
Aye.
Aye. Thank you. Hey, Mike?
Thank you. I want to update you next week, April 5th through the 9th, we'll be running a Red Cross lifeguard training at the Hudson Falls Middle School. They're gracious enough to let us use it. We'll be doing recertifications. I think last year with COVID, it impacted lifeguards getting recertified. So we have a full week of training. We have a full class for lifeguard training as well as recertification. So I want to thank Hudson Falls School for allowing us to do that. I also want to follow up. I'll be meeting with Granville Youth Middle School to continue the youth court training with the school. We had our first training 2 weeks ago. We had 20 kids that were there, and I'm looking forward to working through this with the school to get that program up and running. We're also starting our youth employment next week. We'll be picking up trash alongside Shine Hill in Hartford, and then moving to our pull-off areas on 22 and doing some roadside, as well as cleaning up parks. And the park cleanups for Hewlett's and also over in Lauderdale are scheduled for May 12th. So we'll be busy with that. And the last thing I have is that we'll be working with the Sheriff's Department and with DSS to identify 17 youth in the event we can safely have a sheriff's camp this year, which is held out in Corogo Lake last week in July. So we're tentatively planning to identify those youth and get them ready to attend. So that's all I have at this time. Are there any questions?
Okay, I don't see any. Thank you very much, Mike.
Thank you.
Have a wonderful week, okay?
You too.
Yeah. Okay, we're going to go into Tammy. Good morning.
Hello. Good morning, everyone. The first item on the agenda was to request a waiver from the RFP process for funding that had been designated to support the preparation for the implementation of the Family First Act. In total, that award had been for $30,000. And as a reminder, I've been talking about this throughout the last probably 2 years at this point about using this funding to support the recruitment of more family foster homes. That money had initially been awarded in 2019, and it's actually set to expire today. So our preparation on this has been hurried up quite a bit over the last few weeks, and took a look back to what had been supported in a work group meeting that was held about a year ago and was attended by some board members. It was a result of a request that had been filtered through this committee to appoint board members and some county representatives, county different department heads to talk about what we should do. So I looked back at those notes and went through what I felt was reasonable to support from it. And we've actually worked through some different purchases. We've talked with county admin and purchasing. And at this point, I don't believe that I need an RFP, but I will tell you what we've done with the funding. We have purchased a supply of brochures and flyers that have been printed for this purpose specifically. There's also lawn signs and banners. And we're going to have 5 billboards throughout the county that will have advertising on it. And that is actually set to start. I believe I noted to myself that it was going to be on April 5th, I want to say, that the boards will go up, and they'll be running for 2 weeks after that. The balance of the funds is $18,434. And so again, looking back at the purchasing policy, we're going to use that in an MOU with Berkshire Farms, which is the voluntary agency that we use as our first go-to when we're looking to make a placement in foster care. So we're utilizing that ongoing relationship with them to support ongoing recruitment, certification, and support of current foster parents, and as well as those that will be coming through their training, and perhaps that will be a direct referral from us when we ask family members to become certified so that they can be kinship placements for children that come through our system and, moving forward in the future. So Berkshire is not going to deduct anything for admin costs from those funds. Are there any questions about that?
Good work.
This is an example of what the boards are going to look like. However, it's probably being mirrored on here. So, but anyway, hopefully you'll all see them, and maybe some of you will consider being foster parents. Some of you already have. The next thing on the agenda is the fact that the term of my appointment as commissioner expires on May 31st. The term for Commissioner of Social Services is specified in law that it would be for 5 years. So I would like to be commissioner again.
I'll move that.
Okay, we have a motion. Do we have a second? Don, Jay, Paul?
It should be unanimous, you know.
Yeah, it is.
I know I
Thank you.
can't vote on this committee.
Yeah, Tammy, thank you for doing it for another 5 years. It's a huge position, and we appreciate all that you do. So
Thank you.
you're welcome.
If Roger needs any help on the resolves and whereases, I can give him some wording.
I have plenty in mind, not to worry.
Thank you. Thank you very much for your support, and hopefully the larger group of 17 will as well when this comes before them.
Thank you.
Next thing that I have.
You gotta vote. Okay.
Oh, I'm sorry.
Roll call? No. Okay. All in favor?
Aye.
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 Okay. Daryl? Is Daryl there? Daryl Wilson, are you on? He said yes. Oh, you said yes. Okay. I'm sorry, I didn't hear. Okay. Everybody's voted, and we're done, and thank you, Tammy.
Thank you.
Going through to employee-related purchase requests.
Yes, and so this is another thing, I have things listed that I forecasted, but I don't necessarily need at this point. So I had suggested last month that I might be coming to you for support to use some department funds towards staff appreciation event or effort, or some sort of an activity. And I also told you that in the past, we've actually collected money, personal funds from our managers in the past to be able to do this as well. And at this point, that is what we're going to do this time, as well as our managers will be contributing funds so that we can provide something specific to the staff in our appreciation of them. And so I don't need your support to spend department funds at this time, but I may come back at some point in the future with a great idea that I would be running by you.
Sounds great. Thank you.
I do have one follow-up item. I had been asked, I presented in January about the bandwidth issue that we have in social services on the state network. And I had requested your support in moving forward with a cost for that installation or upgrade. And I had said to you at that time that I was concerned and didn't feel that the county should have to bear that expense, but that I had not yet been able to be successful on my pursuit of that case with the state. So I was asked about it last month also. And at that point, I was embarrassed to say that I hadn't gotten anything back from the state. So that caused me to ratchet up my activism. And I did then get granted with an answer. I had a phone call pretty quickly with a few people from the state ITS agency. And they told me that they had been working on resolving the issue. They had not been sure within their own department who was responsible for this, but that they had then done some research and figured out the fact that the state needed to bear that cost for us. So I got a verbal agreement or indication from them at that point that they would be. And then a few weeks later and earlier this month, the state agency of ITS presented to the New York Public Welfare Association commissioners meeting on March 11th and affirmed to us again. And so far what we have is in writing in terms of a PowerPoint that they provided us copies of, saying that the network upgrades needed to support the state applications that we use to provide the work for the state here locally will be funded by the state. The wording on that says no other significant cost increases to the local social services districts. They weren't able to break that out for us in any way, but certainly that'll be something that we stay on top of.
Excellent.
So anything else about that?
Any questions
And-
for Tammy? No?
Okay, something to look forward to. Gina and I are working on the annual reports for 2020, and we'll plan to do a presentation to the committee in April. And there is an add-on, there is an item for Gina. I'm not sure if you want me to cover that at this time or when that is on for the agenda.
Yeah. If Gina's not on, if you want to fill in for her, Tammy, that would be wonderful.
Gina had asked me to be able to do this for her in her absence. So I'd like to move forward a request for Office for the Aging to backfill the position of Nutrition Services Coordinator. This is something that we have communicated with personnel on as well.
Move it.
Okay.
I'll make the motion.
Sorry, do we have a second? Is that you, Paul?
I'll second.
Okay, thanks, Don. Okay, all in favor?
Aye.
Aye.
Thank you. Okay,
Thank you. And that's all I have.
thanks very much, Tammy. Have a great day.
You too.
Stay safe. Yep. Okay, I'm pretty sure I saw Rob on here. Hi, Rob. Good morning.
Morning. Okay, so just go ahead.
Mhm. Yes,
So
sir.
I have two resolution requests to present, both for appointments to the Washington County Community Services Board. First, we have Lisa Mead, Hudson Falls resident, for the term to run January 1, 2020 through 12/31/23. This is actually a vacancy created when Sam Hall had retired or resigned in December 2019. We had left the seat vacant for a while. We had trouble filling this one. So we'd like to keep the term, as mentioned, January 1, 2020 to 12/31/23. And then I don't know if you want me to go ahead with the other request, or do we take motions and vote on separately?
I think we'll do them both together, Rob, please. Thank you.
Okay, my other request is for Adele Potter to be appointed Fort Ann resident to the Washington County Community Services Board for a 4-year term to run January 1st, 2021 through December 31st, 2024. She will fill a vacancy created by resignation of Desiree Boucher, which was effective October 1st, 2020.
Okay, so Brian's moved it. Do we have a second? Okay, Paul, thank you. And Daryl? Okay, thank you. All in favor?
Aye.
Aye.
Any opposed? Okay, thank you. Okay, Rob?
Okay, next is just an informational item. I wanted to let the committee members know that I think you're probably aware that we, for the third and fourth quarters of 2020 and the first quarter of 2021, our state aid funding had a 20% withhold on it. That 20% has now been restored. And so we have been able to receive that funding and start getting that funding out to our agencies. So just wanted to let the committee know about that. That funding has been restored.
Thank you.
Any questions on that?
No? Keep
Okay,
going.
if not, I also had then wanted to just provide a little bit of information about the 2021-22 New York State Executive Budget Proposal. I know they're still in negotiations on what's going to happen with the budget, but two things we were just keeping an eye on. The governor had proposed a 5% permanent cut to state aid going forward, and also a 50% reduction in some jail-based addiction treatment service funding that Washington County receives in the amount of $60,000 that is currently contracted out to Behavioral Health Services North. It used to be the hospital's Center for Recovery providing those services, but now it's Behavioral Health Services North operates the Center for Recovery. So the proposal was to take that funding from $60,000 to $30,000. With the passage of the stimulus, though, I think we've been hearing that any proposed reductions, including the state aid 5% and the jail-based funding, are probably likely to be to not go through as part of the enacted budget. But just something we're keeping an eye on.
That's quite a reduction.
Yes.
Thank you. Okay. Any questions for Rob on that?
Okay, if not, just the other thing I just wanted to go over a little bit. We do this sort of like toward the beginning of each year. We take a look at just sort of, the past year, some of departmental or even system-wide accomplishments, sort of like what went right, what went wrong during the year prior, and then sort of looking ahead to some departmental goals. So I did just provide a handout focused on that. Some of the things that that we felt went well in 2020, even despite the COVID issues and everything. We did have the major transition of the outpatient mental health, addiction, and family support services from Glens Falls Hospital to Behavioral Health Services North. So that was accomplished. We did assist the local provider system in management of various COVID-19 issues while maintaining availability of appropriate services. Updated our departmental county website pages. I don't know if folks have been on our website pages for our department lately, but we have updated that recently. I know not as many people maybe go to the web for information, but we wanted our information to be fresh and current. We're not real savvy on social media, so that's where we have most of our information. We also have developed some COVID-19 grief resources that are on there in the midst of the sort of the height of COVID. We had developed that for families that were experiencing loss of loved ones and could not, grieve in the normal traditional ways. there would be some resources there, and we had some good community partners in hospice and some others who, the hospital, Glens Falls Hospital, helped us with that. So if you haven't seen those resources, you could seek them out there. Also, the jail-based treatment and support services, that funding was received last year. So we did develop that as a contract with Behavioral Health Services North. Increased access to mental health services for youth through development of some school-based mental health services in Greenwich and Salem. So we're working on that with Behavioral Health Services North. Also, we've focused, the COVID actually kind of pushed our agencies in a way to advance some of their telemental health capacity. And so we've been working with them closely on that. There's some other things there. I won't go through them all. In terms of some of the issues that we ran into, things that could have gone better. You know, when we were transitioning the services out of the hospital to a new provider, we had identified one provider, Citizen Advocates, and they ended up pulling out of the process sort of midstream. And so we had to find another provider. Fortunately, Behavioral Health Services North, we were able to work with them. But that was sort of a major snag in that process. And we ran into some issues during COVID. We were trying to have a staggered work schedule where people, 50% of the staff at a certain time during 2020 had them working remotely. And we had some technology issues that we ran into. So I don't know if you recall, but toward the end of last year, we got permission to use district funds to buy some laptops. We just had run into issues. People didn't have laptops. We didn't have departmental laptops for everybody. And then using their home computer equipment was a problem with Warren County's server connection and everything. So we did get permission to purchase those laptops. What we ran into, unfortunately, though, was a delay in that because of the shortage of the, backlog in manufacturing of the chips. So delivery of those, we're still waiting for them, and actually we're back to full on site at this point. But to the degree that we might be able to still have to remote, at some point we'll have those laptops and be able to do that. I mentioned the 20% withholds. We were impacted by that. And another issue I'd just like to bring forward, our office has struggled with obtaining timely and accurate data on drug overdoses and deaths by suicide. We were hearing sort of anecdotally that during COVID, overdoses were up, suicides were up in certain areas. And so we've had trouble getting that, timely data on those issues. So we're kind of working on that. And in terms of departmental goals then for 2021 going forward, we're working with the Addictions Care Center of Albany on development of an residential addiction stabilization and rehabilitation program for men. I don't know if you recall, but within the last 2 years, they opened up a women's residence in our 2 counties. And now the focus has been on developing a men's residence as well. We hope to have that open the summer to fall of this year. We want to continue the school-based development of services. This creates access to services for children and youth and families in their home communities by developing these satellite clinics in the school districts. It also is somewhat of a less stigmatizing environment. They can be seen right at school. They don't have to, no one has to know that they're going to a clinic. Also, development of data collection process, as I mentioned, to focus on getting some data on the drug overdoses and deaths by suicide. So we want to develop a better process for that. Continue with advancement of the telemental health capabilities. We also want to develop local crisis intervention training capacity. This really folds into some of the police reform initiatives and collaboratives that were going on. Most of the agencies that we would talk to and we're working with were very interested in developing this capacity to have this training locally. We also are exploring implementation of something called the Law Enforcement Addiction and Mental Health Referral System. This allows officers to make an online referral for addiction or mental health services right from the field. There's some issues, I guess, that we're kind of working through with that. Hoping that that can be something we might be able to implement as well. There's a few other things here. Again, won't go through them all. Of course, we want to assist Ken and Denise DeResta in development of the county's veterans. Joseph P. Dwyer, the peer-to-peer support program. I know they've been in a process of recruitment for the coordinator. COVID, kind of delayed things, but that seems to be moving forward now, and anything our office can do to help support that, we're happy to do. So I just wanted to go over that with the committee and let folks know kind of like what we're working on this year, and certainly open to any other feedback or any questions from the committee.
Anyone have any questions for Rob? Okay. Rob, that was a wonderful kind of looking back and looking ahead synopsis that you gave. There was something in the paper today about COVID patients leaving the hospital and going back into homes. Is that something that's happening at the state level? Is that something that is?
Yeah, I think that's something that they are looking at, just in terms of what is the policy. From what I read, it was also, similar to what was happening with the nursing homes, right? Like that people, maybe positive patients were entering into facilities and putting other people at risk. From what I've heard from our local providers, they've actually been very fortunate in low rates of any infections or COVID infection in our group homes. I don't have specific data on it, but I can get that for the committee if you'd like.
Just a curious question, with it being in the paper today. Thanks for all your hard work. Thanks for all your groups that work so hard. I like a part of the mobile health crisis response. That could be very helpful for Warren, Washington County. And I know we've had that in the past, but to continue that.
So Parsons and Child and Family Center, Northern Rivers Agency, they operate a children's and adult mobile crisis team in the two counties. And they've been very involved in those discussions with the police reform, looking for ways that they can be, available or better available resource to our local law enforcement agencies to help handle, any issues related to individuals with experiencing a mental health crisis or similar.
Thank you.
Yeah.
Okay. Thank you very much, Rob. Do we have anything else? Okay.
No, all set. Thank you.
Yeah, thank you. Okay, we're on to, I see KJ on here.
Good morning.
Good morning.
I have Tina in the room, across the room with me.
Okay.
But geez, Tammy and Rob, you guys are a tough act to follow because our annual report, Tammy, ours is going to be easy. That just says COVID. And Rob, department goals. I think our goals are just to keep our sanity and our sense of humor, which, that in itself is a work in progress. But we'll try. We'll be calling on you guys to help us out for that. So, all right. So our first item is just permission to apply for the Child Passenger Safety Passenger Grant. It's due May 1st. That is a grant that our health educator applies for every year to go with the car seat program and stuff. It's $15,000, but we do need permission to at least apply for the grant.
So moved.
Okay.
I'll second it.
Okay, Don and Paul, thank you. All in favor?
Aye.
Okay. Okay, KJ?
The next I have is just permission to backfill the WIC nutritionist position. We have a resignation that is effective on the 26th. And we would like to backfill that position.
So move.
Okay, Brian
I'll
moves it.
second it.
Thanks, Paul. Paul seconds. All in favor?
Aye.
Okay.
At
Any
least the
opposed?
good news from that is the nutritionist from WIC is moving to the state, so it's moving up.
That's great. Okay,
The next one I have is the amount of our unused vacation time related to our COVID response. We have several people in our agency here that we just, I'm not sure how we're going to fit in their vacation time for when their anniversary dates are. One being myself is the 1st of June. We have another one at the end of May, and another one is Janet, July, beginning of July. Which the unfortunate part too is those Janet and Pat, they also are orienting new people from vacancies that we've had. So it's hard to have them vacant and stuff with taking the amount of time. So we need to know how we're going to proceed with this, rolling over their vacation time into the next year with the policy and stuff. We need to have permission. But it's pretty much excessive time. I have one that will have 26 days. She does have some time scheduled as much as possible, but we'll still have 26 days. So I guess we're looking for direction as to what we can be doing with this.
I think Brian has his hand up. Let's see what Brian has.
Yeah, Matt Hicks is on. I'd like to have Matt weigh in. I think this is something that probably should go directly to personnel because this is absolutely COVID, specific. So whether we do something different in this situation or we stay the course of what we've done in the past, I think that's going to be a personnel subject. So if Matt wants to speak to that, I'll have him chime in.
Well, thank you, Brian. I did not see that bus coming. Yeah, it does go to personnel, but I would actually continue the bus going and send it towards Melissa to have her comment as administrator on how we handle this in the past and what our normal procedure is.
So as you're all aware, we recently stopped the automatic carryover of vacation time, which we had in place for an entire year. So at this point, all the departments were directed to follow the employee handbook as far as the carryover of vacation time. And the handbook states that if it's 5 days or less, the request can come to the county administrator or the personnel officer for approval to carry over that time for up to 3 months from the employee's anniversary date. And then any time that's greater than 5 days would have to come to the committee and then be forwarded to personnel. If the question is, do we want to do something other than carryover time, which I think maybe what KJ is referring to as far as maybe paying out or something. This is not something that has been discussed so far by any of the committees or the board. So at this point, I believe we're just requesting the time to be rolled over. And I guess we'll have to deal with it as time goes on if we're still unable to use that time.
Okay.
So KJ, are you looking to roll it over for 3 months to continue it so they can use it?
We're just looking for direction of how we're going to do it. Honest and truly, the 3 months, I mean, it's quite a bit of time that we have. So we're just looking for direction. I'm not sure with the COVID response of, we thought there was a light at the end of the tunnel 2 weeks ago that was not attached to the train. And from the last 2 weeks, we are finding out that light is attached to the train. So, hard to tell as to when we're going to be able to take it.
And just,
Melissa, go ahead.
yeah, I just wanted to respond to KJ. So because the time is more than the 5 days, that would, the board can actually approve, or the committee can approve that time to be carried over for more than the 3 months. So we could actually carry it over for the entire year if that's what the board wished to do. And then if it gets to be closer to the end of the year, and hopefully this will all be well over by then, and you still can't use your time, then maybe we'll want to maybe address the subject again and see what we'll want to do. But that would be my recommendation at this point, would just be to approve the rollover of the time, and then we'll see where it goes from there.
So,
And Dave, go ahead.
so I don't know what the time involved is, but I'm guessing some maybe 4 weeks or more. So if your anniversary comes up, they got 4 weeks held over, and now they go another, after their anniversary date, go another 4 weeks. That's 8 weeks of time they have to use in 1 year. And, maybe we're just kicking the can down the road because COVID situation is not going to go away overnight. It's going to be with us for a while. Maybe we should figure out how to deal with that now instead of kicking the can down the road. Maybe we should consider some sort of fair, equitable solution to this that doesn't penalize them. They put enough time in their efforts that they've done so far.
Thank you, Dave. Brian?
I'm sure they need a break. I mean, as much as we want to get, I think we want to figure out what they actually want and need. When we look at this going forward, I think probably it's got to be hashed out more than just today vaguely, but I think that these people have been working pretty hard and they need a break. So I think we need to make sure they get a break. That's where I'm at.
And KJ, just a question, I mean, if you had someone that did like vacation relief or something that came in and allowed people to have a space to get away for their vacations, right now you have all feet on the ground, and more so, 7 days a week still. And we've certainly had added people to that department, but the needs still continue to increase, and I don't see that going away anytime too soon. So there's a piece of physical health, and then there's the other piece of mental health, and also.
And we have encouraged people to take it. You know, a lot of us were affected last year where we had to roll over our time from last year to this year. So again, it has snowballed the effect, even with, personal time as well as vacation time. So everybody is taking some time. We just are not able to schedule all the time that they deserve, that they have credit for and stuff.
So,
yeah, Dave?
Instead of carrying this out in open, why don't we have Melissa and Danielle sit down with KJ and Tina before the personnel meeting to sit down and figure out some suggestions of what they want to bring to the board to the personnel committee to discuss. I think that's probably the best way to approach it from now versus trying to air it out in here.
Yeah, the amount of days and the amount of people and everything.
It's not a one-size-fits-all, I don't believe.
KJ, does that sound like another meeting for you? Would you be willing to take?
Absolutely, absolutely.
Okay. But
Yeah, we're always looking for guidance.
Okay. Do we need a motion to have that committee set up to go forward to personnel? No?
Oh, they can just talk about it.
Okay.
Bring it to personnel if it meets the chairman of personnel's approval.
Yeah.
He has so much more power when he's not here.
Yes, Matt?
If I had any power, I'd mute you. But I think it's probably, from a procedural standpoint, move something out of this committee to personnel to give us guidance to say the personnel committees, or excuse me, the HHS committee is on board with the administrator and the director coming forth with a proposal that will approve, then go to the full board. So the process is taken care of properly.
Yes.
So,
Thank you, Jay. Do we have a second? Don Ward, thank you very much. All in favor?
aye.
Aye. Thank you. Okay, KJ, what's next?
Next is the resolution to carry over money from the 2020 to 2021 from our COVID grant. That was a $95,000 grant, and we have 12,000 to care, well, a total of 19,000, a little over 19,621 total to carry over into accounts.
So moved.
Okay, Brian moves. Do we have
I'll
a second?
second it. I'll second.
Thanks, Pat. Paul, thank you very much. All in favor?
Aye.
Thank you. Okay, JJ?
And just my last, I always like to leave on a positive here. So most of you have probably already seen that we have started vaccinating our homebound. So that's our next steps in getting shots in arms. We've had 2 days of it, has gone pretty smoothly. And we're hoping to get more J&J vaccine, which is just the one-shot deal. And of course, you all have seen that the guidelines. So as of next week, it's pretty much, it's open to everybody. So we expect to be very busy and actually out into the community more, hoping to get our agricultural workers done once we get our homebounds done and stuff. So we're looking very forward to that and setting up different things. Our pod this weekend, we have combined several of them. It's going to be a very busy pod, but we've had to move it because of the construction at the school. Over on Burgoyne, but Hudson Falls School has been so gracious to let us use that. Tim and Glenn have done a lot of work on that for us. So it looks like that's going to be a good setup and we can get more through. We're increasing our vaccinators if we need to have them and stuff. So again, we're getting there. If you look on the vaccine tracker, we have at least 26.3% of our population vaccinated, which is more than the state overall, but it's a slow process. I think there's still some barriers, but hopefully with all the availability, people are going to be able to get in quicker and stuff. Any questions?
Any questions for JJ? I just want to thank you again for your vaccination distribution. They're a lot of fun. They're either people are coming dancing down the hallway or they're anxious, and all of you will do it with humor and professionalism and efficiency. It's a pleasure to watch, and we thank you because
thank you.
Huge effort.
Huge efforts and big undertaking with a lot of partners that we could not do it without. It's amazing to me of how much support and stuff that we have had from every place, and we really, really appreciate it. So that's part of how we're keeping a little bit of our sanity and some of our humor.
You're doing a great job. So 600 this Saturday, is that about right?
Yes, right around 600, about 400 second doses and 200 first doses. Yep. It'll be busy.
It will be. Thank you. Get some rest between now and then. Good luck, right? Anyways, anything else, KJ? No. I think I saw Ken Winchell on here. Ken, did you want to add something?
Oh, yes, I appreciate it. Thank you. I got a couple things to add. First thing I wanted to do is kind of piggyback off of what Rob York said earlier with the peer-to-peer program. First of all, I appreciate his office's assistance with everything. He's been a great help. Between myself and Denise, we have agreed on a candidate to hire and offered the position, and she has accepted just as of late yesterday. So we are excited to keep the program moving and get it back rolling. The second thing I wanted to bring up was a proposal for a resolution. The purpose of the resolution would be to designate the County of Washington a Purple Heart community, recognizing that many veterans of our county have earned the Purple Heart Medal as a result of being wounded while engaging combat with an enemy force, construed as a singularly meritorious act of essential service. The contributions and sacrifices of the men and women of Washington County who served in the armed forces have been vital in maintaining the freedoms and way of life enjoyed by our citizens. And we'd like to designate a day to be determined to recognize the recipients of the Purple Heart Medal.
That's wonderful. Does anyone have any questions for Ken on this? Is he looking for a resolution? Ken, are you looking for a resolution? Okay, Jay's going to
I'll
moved it.
second the motion.
And Paul is, all in favor?
Aye.
Thank you very much. Thank you, Ken.
Thank you, everyone.
Yeah, anything else? Okay, I
I
think
don't
we're
have
good.
anything.
Yes, we're good. I guess that's it for today. Thanks, everybody, for coming, and, do we have a motion to adjourn?
I'll make that motion.
Thanks,
Second.
Don. Thank you. Thanks for coming. Have a safe week, and a happy